This short video is for educational purposes. Please don't use it to diagnose yourself. If you are worried about any symptoms that you have, you should consult a healthcare professional or your GP. This is for patients who want to learn a little bit more about their back pain and the structure of their spine, and it would also be useful for students starting to learn basic anatomy. There are three parts to this presentation. First of all, a very brief summary of how the spine is put together and how it works. I think whether you're a student or a patient, you need to understand that if you're going to understand what can go wrong, which is the second part of the presentation. And then if you are a patient, if you can hang on till the end, I've got 10 tips for how to manage back pain. We often think of our spine as the foundation to our body, which is true. You know, everything hangs off the spine. The ribs, which protect the internal organs, the arms and legs, the head. It's kind of the central pivot point for movement, but the spine is actually much more than just a foundation. The human spine has quite a complex job to do. It needs to be able to move, as this green twig here is blowing in the breeze, but it also needs to do its job of keeping us stable and upright, and that's quite a difficult balance to get right. Too mobile and it becomes unstable, and too stiff and it becomes unusable. When a baby's first born, it just has a C-shaped spine with one spinal curve. Once the baby starts to take an interest in the world and look around at things, it starts to develop what are called secondary spinal curves, which I'm going to show you in the next PowerPoint slide. So here's the spine of an adult, and we can see it looks a bit different. We've got a head facing towards the right. In the neck, we've got a curve going one way. In the middle of the thoracic spine, we've got a curve going the other way. And at the base of the spine, we've got a curve going yet another way. So we've got these three curves which stack on top of each other to give the spine a really strong shape. And here's what we call them. The neck is called a cervical spine, the middle part of your back is called a thoracic spine, and the lower part of your back is called a lumbar spine. Below this we have a sacrum, which joins onto the pelvis, and at the very bottom we have a coccyx, which is the remains of a tail from when we were amphibians millions of years ago. Different animals need different shapes spines and different qualities in the spines. These are the vertebrae from a snake, and you can see here that they are like little ball and socket joints. A snake needs to be extremely mobile and wrap itself around things, so all the bones in the spine of a snake are ball and socket joints. That wouldn't work in a human. It would be too dangerous, too unstable. Humans have 7 bones in the neck called cervical vertebrae. You would think the giraffe had lots of bones in its neck, but it's actually got 7 as well. They've just been really stretched and really elongated through the course of evolution. So what we're going to do is build a spine. So I find it quite useful to think of everyday objects to replace the parts of anatomy. It just helps me to learn things, so that's what I'm going to do here. So the basic unit of the spine is called a vertebra, or in this case a brick. So here we have a brick. Then we have to stack the bricks on top of each other. So we have a column of bricks, and if you notice here, the brick underneath is larger than the one above. The reason being that the bottom brick has to take the weight of the brick above it, and so on. So that's what happens in the spine. As we go up the spine, the bones get smaller, and as we go down the spine towards the coccyx, the bones get bigger. And here are 3 bones together, and just like the tall building on the right, it's broader at the base and comes to a point at the top. As you can imagine, a pile of bricks on its own wouldn't be very good. It would bang against each other and it would wear away very quickly. So what we need is some kind of sponge or donut between the bricks, and that's what we have. And these are called intervertebral discs, and between each pair of bones all the way up there's a soft spongy disc with a hard outside and a soft spongy centre like a jam donut. These discs are pretty strong. In fact, they're sometimes stronger than the bone itself, so it's not unusual for a patient to jump off a wall and actually break the bone rather than the disc itself. And the idea behind the discs is that they allow a really small amount of movement between each pair of bones, and if you add that up, you end up with a spine which keeps its stability, but it's also really mobile. We have some very important structures very close to the spinal column. The most important one probably is the spinal cord. This is the motorway that sends impulses to and from the brain. It's very close to the spine indeed, and because it's so close, it needs to be protected by a ring of bone. So here I've drawn these rings of bone on, which are very important. They can also cause problems. They can sometimes get furred up, and that can cause a condition called spinal stenosis. Another important function of the spinal column is to allow movements, and to allow us to pull effectively on the spinal column we need some levers. So we've got some quite big bony prominences. You can see I've drawn them here in pale blue. You can actually feel these in the back of your neck all the way down your spine, and they're called spinous processes, and this is a site of ligament and muscle attachment really. Put these all together and we have a spine which we can see on the left side here, and that allows us stability and mobility, as we can see on the right sided diagram here. There are many causes of back pain, but I'm just going to talk about the 4 commonest ones which I've just listed here. Arthritis in the spine is probably one of the commonest conditions. It's also known as degenerative disc disease, and what happens here is that the bricks start to get too close together and start to rub against each other, and that can cause pain and stiffness. Even though this looks horrific, it's actually very common, and it's also quite possible to have this and not have any pain at all. So it may be possible to have x-rays that show this, but the patient doesn't have any symptoms. Another common condition is called a slip disc or a prolapsed intervertebral disc, which I'm going to show you on the next slide. It's important to point out that the disc itself doesn't slip. The disc is like a jam donut. It has a soft center with a hard outside, which is very tough and very strong. And I'm going to show you on the next slide what actually happens in a slip disc. So what often happens is that the soft center pokes through the wall of the donut. So the donut itself doesn't move, but the jam pokes through, and just because of bad luck really, that happens to be where the nerves going down the arm or the leg are, and that can give us arm or leg pain. In the case of the leg, it gives us sciatica. And here is a picture of a nerve root being inflamed and squished by the blue intervertebral disc here. Another condition that can happen to our spines and other parts of the body is osteoporosis. This is where the bone actually becomes less dense than it should be. Here on the left picture you can see normal bone versus bone with osteoporosis. So you can see that there's less bone in place. That can sometimes cause pain, or it can sometimes not give any symptoms at all. In the worst case scenario, it can actually cause the bone to actually squash under its own weight. This is quite painful, but it is treatable with analgesia. Probably one of the commonest causes of low back pain is referred to as non-specific low back pain, which is a problem for patients because it means that they can't find any obvious cause. There's no obvious damage, there's no obvious fracture or problems on x-rays, but the person still has pain, and that's very common, and that can lead to frustration. As with most conditions, such as a sprained ankle, we can divide low back pain into acute, subacute and chronic, depending on how long the person's had it. The difference is that the timescales in back pain tend to be longer. So whereas with a bruise or a sprained ankle, we would see improvement within days, we tend to measure improvement in weeks or even months with low back pain. We can classify the risk factors for low back pain into those that are modifiable and those that are non-modifiable, which I will make into another podcast. Things that are non-modifiable are our genetics, and an example of something that is modifiable is whether we smoke or not. What I'm going to do now is go through 10 key guidelines for managing low back pain. These were produced by the Chartered Society of Physiotherapy in 2017. So the first one is to state that your back is a strong and stable structure and it's not easy to damage it. And in 98% of cases of low back pain, it will get better in spite of what you do and not because of what you do. Secondly, quite often patients demand a scan or an X-ray or an investigation. The evidence says that unless there's a very specific reason for that, it's not usually helpful to do that, and in fact it can just make the person more afraid, which causes even more pain and limitation of activity. Many years ago we used to manage back pain with bed rest, but now the evidence says that it's better to keep mobile, avoid bed rest, and try and continue with normal activities as far as possible. It's also important that patients aren't afraid to move. That can cause problems in itself, so don't be afraid to bend and lift and try and find ways that are comfortable for you. Keeping generally fit and well and staying active is probably one of the best ways to minimize the likelihood of a future event of low back pain. Also, the evidence suggests that painkillers will not speed up recovery, but exercise will. The evidence also suggests that surgery is very rarely needed for low back pain. Whilst exercise is important, it's equally important to get rest, and quality sleep is very important as well for your general well-being and pain levels. It's also very important that people with back pain understand what's going on, so that is why I started this presentation with a brief summary of the spine and how it's made up. Obviously, it's very difficult to provide a podcast that covers everybody. If your back pain hasn't cleared within 6 to 8 weeks, it would be wise to seek medical advice. And there are certain symptoms that would alert you to this, and I've just listed some of them here. And thank you for listening. If you have any suggestions, please contact me on Twitter, and I'm happy to try and make a video that will help you.